All right, here we are. Let's get this started. I'm going to make sure all my windows are all set up here, and we're going to begin. Let's pull up the camera. Where are we? Hey, there we are. Hey, everybody. Welcome. Better Spaces is a health and happiness solution for today's hybrid workplace. My name is Dr. Paul Cachoa, and I partner with them to bring you an easy and educational workday session. So today's session is pickleball mobility, how to keep your lower back and hips pain-free on the court. So we know that all pickleball is very popular and it requires quick lateral movement, frequent twisting and bending, all of which can lead to lower back pain or hip issues. So this session, we're going to focus on improving mobility and flexibility to reduce strain and enhance movement on the court. We're going to talk about how poor mobility leads to overuse injuries and how hip and lower back mobility exercises can really help with your movement efficiency so you can move quicker. And maybe we'll talk about a warm-up routine. All right, so a little bit about me. I got my doctorate from Mercer University in upstate Dobbs Ferry, New York. And I also have an exercise science degree from Rutgers University, BS in exercise science. And I'm an orthopedic clinical specialist, physical therapist, a certified dry needling specialist, and a level 1 certified golf fitness coach, and CrossFit coach and a golf fitness coach as well. So let's pull up my slides here. We can get started. And by the way, if you have any questions, feel free to use the chat while we're in here. Here it is. Whoop, there it is, right? So pickleball mobility, keeping your lower back and hips pain-free. All right, so every time that I come on here, I have a class. Because I am a medical professional, I've got to put on this waiver, this slide here, that if you're dealing with something specific, the stuff that we're going to be talking about today is good, useful information, but it is geared at a broad population. If you're dealing with something specific, make sure that you're getting your issues addressed and getting a full physical exam so you can figure out what is the root cause of your problems, what your dysfunctions are, and then also help to address them thoroughly. All right, so without further ado, if you've been to this video should look familiar. It basically summarizes how the body functions on this alternating pattern of stability and mobility. So from a musculoskeletal standpoint, if we start at the foot's supposed to be stable. And if we move up, the next joint up, the next segment's going to be the ankle. That needs to be mobile. And all the way up the chain, we look at the knee, the hip, the lower back, the thoracic spine, scapular, shoulder. All of this, it alternates from stable, mobile, stable, mobile, stable, mobile. And we run into problems in a specific segment when there's a reversal of those roles. For example, if you're talking about hip, that needs to be mobile, right? And if you have a tight hip, if that turns into a stable segment, it's not mobile, then that can lead into issues or pain up or downstream from that segment. So we're talking about the root cause of back pain or the root cause of knee pain. It might be because your hip has reversed its role. It's not stable. I mean, it's not mobile. It's turned into a stable segment because it's become tight. All right. So always got to keep that in mind when we're trying to understand or diagnose why we have issues and what could be the movement dysfunction. We just don't want to focus on where the pain is, not just chasing that pain, but kind of assessing your body as a whole, a connected system of systems, so we can unpack what the root cause is and why you have the pain. All right. So if we talk about the positions that we assume while we're on the court, there's a lot of bending. You can see here there's spine side flexion, hip flexion. Flexion is basically bending, right? And extension is basically going backwards. So we got a lot of bending at the ankle, hip, knee, and then last one over here on this is the hip abduction. Your hip comes apart, right? It goes out to the side as we sidestep. So all of these motions are important for good mobility and quickness on the court, and also to prevent injury. Now, also we have flexion, but we also have a lot of rotation. So here, doing this forehand, crossing over midline with the arm and the paddle, there's a lot of hip rotation, in addition to all the flexion that we talked about, and then there's spine rotation as well, okay? So if we kind of boil this down into some of the cardinal motions that we're seeing here is what we call a hip hinge. It's basically bending over at the hip. And if you're going to be effective, let's just say at the kitchen or hitting those, getting to those low balls, we want to be able to bend strong and be strong in that low position. All right. So we're sending our hand forward with our paddle, trying to work and trying to catch those balls out of the air at the net. But we also want to send the hips back. Sending the hips back in this hip hinge position allows us to be balanced over our feet so that we can volley, but also be prepared for that counter attack, being able to block those balls back as they come fast and quick. So one of the exercise movements that I always prescribe to a lot of the clients that come in to see me is incorporating this hip hinge pattern. And I think it's very applicable to sport in general and life. So let me blow this up here so you can take a closer look. So as you can see, this movement is called a deadlift, and it incorporates the hip hinge as you pick up this weight off the floor. And what we're looking at here is lumbar flexion versus a neutral lumbar spine. All right, so if we're going down and bend something up, physiologically, our lumbar spine is designed to bend. It can bend and it can side bend. It doesn't rotate a lot. Most of the rotation happens in the hips and the thoracic spine, the mid back. But I see this a lot, that when we do bend forward, we get this rounded position. So this exercise here, this deadlift, really teaches us how to be strong in this hip hinge position and access and utilize the glute muscles as we're trying to get into these athletic postures. All right. So not only are we talking about being capable of moving our joints and body into those positions, but also being able to control those positions, having enough joint sense, coordination, balance, proprioception, what have you, so that we can be aware of where our body's in space and be balanced so that we can move effectively. So a couple of things that we're going to be talking about here is a hip mobility, some lower back exercises to stretch that out as well, and maybe a little bit of warm-up routine. But heads up, in the Better Spaces apps and on the website, there's a host of other videos that I put on there. You could look for them on demand, and they also do a deeper dive into how to warm up for any sport. All right. So now that we've got all our kind of baseline stuff, let's kind of get into it here. So you're going to get up out of your chair. We're going to transition into this two shot here, and we're going to talk about some easy things that we need to work on. All right. So just like we're moving forward, we know that the hips need to be mobile. All right. So the hip basically, flexes and extends, but also rotates, external, internal rotation. We want all those motions together. So one of the exercises that I like to do is called the hip drop. And you could do this in several different positions. We could start off in the real easy position. You could do this lying down on your bed or on the floor, it doesn't matter. What we want is to get the knees bent about 90 degrees and your feet wider than your hips, okay? If you do this movement with the feet very narrow or in line with your hips, you'll feel this a little bit more via your lower back. But if we want to isolate the hip joint, we're going to try and assume a wide stance with this. So the first thing is we're going to be lying down on your back. See if I'm in camera. Perfect. And keeping the ribs still, we just do a hip drop where we have the feet nice and wide and we allow the knees to kind of rotate and fall to one direction. We're going one side left, and then we can go right. So when we're talking about mobilizing a joint or loosening a joint up, we don't necessarily have to hold any end range positions. So it's a little bit different than doing like a static stretch. We're just trying to help to move that joint through as large a range of motion as we can tolerate, because as we move a joint, it actually creates it causes the cells that line that joint to produce what's called synovial fluid. Movement produces synovial fluid, which helps to lubricate the joints. Immobility or not moving, that can create less synovial fluid, and then the fluid that is in the joint becomes more viscous and stiff. So if we do that for about 1.5 minutes to 2 minutes, that would be a good prescribed amount of time. If that feels easy, then we could start to do it in a more upright or reclined position. The more vertical we are, the more difficult this will be, because we really wind up that hip socket a lot. So if I do this with my hands supported, I can kind of mimic the same hip drop in this position here. But if I wanted to do it and I'm really mobile, I'm a little bit tight today, but we could try it in a sitting position where we kind of do this hip drop and then kind of rotate and then do this. So that's much more advanced, but the gist of it is just trying to get the hips moving as much as possible. All right. So the other part of the lumbar spine needs to be stable. So once we're kind of, looking at how the back can move, we talked about how it can flex and extend. We just need to be aware or have what we call proprioception of what our spine is like. So if we get onto all fours, our spine is going to be very supported here with the hands and the knees. And then we want to just try to take the lower back and then try not to move the shoulders or the upper back. Take the lower back in your pelvis and try and round out the lower back and then arch it or sag it to the ground. So the movement here, we want to make this really as isolated as possible to the pelvis and the lower back. So here I can kind of feel if I round up all the way, I push my hips, I push my tailbone underneath me, I tuck that in, and I have my abdominals kind of creating this motion that pushes my lower back to the ceiling. And if I reverse that, my pelvis tilts the opposite direction, it tilts forward, and my lumbar spine arches, it sags to the ground. Maybe I feel a little bit of tension in the lower back. So once we're kind of building this awareness of positioning of end ranges all the way into extension and all the way into flexion, then we want to see, all right, can I normalize this, or can I get into the mid-range or neutral spine? So I could check a mirror, you could have a friend check you, does the lower back seem flat when you assume that neutral position? We don't want to have excessive extension or excessive flexion. We're just going to find the mid-range. And then we could take that into a high kneeling position or a tall kneeling position and see, can we do the same type of movement here where I keep my shoulders and my trunk as still as possible, and I tilt my pelvis into the forward direction, which gives me that same arch of your back with a little bit of contraction in my lower back muscles. And I tilt the pelvis the other way, which I feel using the abdominals, and because I'm more upright now, into my glutes as well. So I'm going to get into these positions and feel, all right, where's my neutral again? Okay. Once I find neutral in that, we can progress into a more upright position. And then, from here, I'm neutral. Can I arch my back and then flatten it or round it out? So here I'm developing that awareness of where my neutral is in all these different positions. And then if I can keep my spine in neutral and access that hip flexion that we saw on those previous slides, I basically send my hips back. And then here I've got this very stable lumbar spine with getting my hips into this position. So here I want to be comfortable being able to get into this position where my knees haven't gone forward, and I can be balanced reaching forward with my hips and maybe my opposite arm back. So this would be the position that you would normally get in. And if we want to be fancy with this, we can actually add a little bit of a lateral step here where I really load onto one leg and then abduct, or move that hip out to the side. And I'm doing this with my hand to kind of mimic what I would be doing with a volley. So that's kind of like how we kind of develop some mobility in our hips and awareness and stability in that lower back. If we can access the glute muscle, that'll help prevent the lower back from getting tight or the knees from getting too much stress, especially with these lunges. What I see oftentimes when people come to see me with back or knee pain is that they have a hard time being aware of what their spine is doing in this position. They typically get into this position here where they're rounded because, again, our body adapts to the positions we put it in. So if you're wind up sitting for the majority of your day, this is where your spine is all the time, and then that's comfortable for you. That feels like normal versus a neutral spine that feels a little bit abnormal. So developing that awareness, that proprioception, is key, and then trying to avoid getting into this rounded positions with the knees forward. Because in this position here, there's a lot of stress on the knees, the hips are kind of muted, the glutes aren't working, and then sometimes the back will be doing a lot more work. So the hip drops, and we've got the hip hinge, And then if we wanted to really get fancy and add in some balance and stability into this position, we could do the same hip hinge position, but just challenge it by taking one leg and then maybe putting the toe only on the ground. So if I have my heel elevated on one side, my right leg, and the majority of my weight, 90%, is going to be on my left side, I could do the same thing. I could do the same sequence of contracting the abdominals and lower back, tilting my pelvis, finding neutral, and seeing if I can get into this hip hinge. But now it's a very dominant left side. So I'm only using my left side to really activate this glute and then see if my hip can be stable and using that motion to get down and up. And I can repeat on the other side as well. Okay, so that's another progression that you can make for stretching. Now, I mentioned sitting. And oftentimes we'll get into this position where your hips or knees are bent like this. And just like with chronic back issues, this area here, the front part of my hip, can get tight. It adaptively shortens because the angle is closed over here. So when I do go to stand, I'll exaggerate this. When we want to extend the hips or stand up straight and this part of the body is tight, what tends to happen is that we try and borrow from the lower back and then we stand up straight like this. So oftentimes we get this really tight hip flexor, which puts more stress on the lower back when we do try to stand up. So one of the stretches I also like to do for opening up the hip is this half kneeling hip flexor stretch. And I've gone over this in a lot of other videos that I've done. Basically just getting into this half kneeling position, trying to open up this line here in that front pocket, that hip area, by contracting the glutes, which normalizes the pelvic tilt, keeping the abdominals on, which connects my sternum to my pubic bone, so this angle doesn't change. And then from there, I could slide my hips forward, which opens up the front part of that hip and that muscle, holding this stretch for 30 seconds. Now, if you can't get into this position, you could certainly try it off the edge of your chair. If you just kind of drop one hip and kind of mimic that same thing. It doesn't matter what you're doing, just as long as we are able to kind of bring one knee down and back without compromising this shape, not letting our back arch, because the muscle that we're trying to stretch starts on your lower back, dives through the abdominal cavity and inserts into the front part of the hip. Because it crosses so many joints, oftentimes people will get into the stretch, but then they'll have this broken core. The spine kind of opens up, the ribs and the pubic bone kind of separate and the back arches, and then they search for the stretch. I always tell people that if you're trying to stretch a muscle, it's like a rubber band. You can only stretch it if both points, the attachment points of that muscle, are stable. If you pull one end, but the other end isn't stable, what happens is that you just kind of continue pulling and you don't get that stretch. Only when both ends of that muscle attachment, the origin and the insertion, are stable, that you can create that solid stretch. So mobility in joints, we want to move them through a large range of motion for about 1.5 to 2 minutes, pain-free. And then stretches, static stretches, we're trying to lengthen a piece of tissue, some soft tissue. We want to hold that for at least 30 seconds and make sure that both ends of those muscle attachment points are stable. All right, so that's my quick and easy warm up and stretching routine here. I'm going to give it about like 30 seconds. We could talk about any other questions that you would like to cover. If there is none, I will let everybody go and enjoy their day. Give about 30 seconds. All right. Well, thank you for joining me today. You can look for this session and many more on demand on any of the Better Spaces apps. I will be back next week, Tuesday, May 13th. We're going to talk about strength training for pickleball. We're going to dive a little bit deeper into core and leg stability for better court movement. A strong core and lower body can help pickleball players move quicker, react faster, and reduce your injury risk. This next session is going to cover exercises to build strength, improve balance, and protect the lower back. So you'll learn how a weak core and leg muscles contribute to lower back pain. You got a little bit of preview of that today. And we're talking about core stabilization drills for better control and endurance, leg and glute strengthening exercises for quicker movement and safer pivots, and how to maintain proper posture during fast-paced play, as well as strength-based recovery strategies for injury prevention. If you have any questions, you could feel free to email me here at paul@par5pt.com or team@betterspaces.com. All right, thank you very much, and thanks for coming. Bye-bye.